Hi everyone, welcome back to the Dr. Sia channel. In the video here today, I'm going to be ranting a bit. It's not about attachment, it's about something that I get pissed off about, and it is why have we as psychologists, as therapists, as counselors, as psychiatrists, whatever, why have we been reduced to advice giving tools? I'm sick of it and I'm going to rant about it, and if you're sick of it too, or if you want to know why I'm sick of it, watch this video. Let's get started. I can't say how many people come to me and essentially, they sit down, they wait, they book, they wait for 2-3 months to see me. And my colleagues have been saying the same thing, and they come and all they want at the end of the day is just some strategies. I mean, look, what happened to psychology? What happened to psychotherapy? What happened to me, you, two people figure out what's going on within you, deep within you as a person, to understand something so complex that only a trained person could do together with another willing person? Like, what happened to the fundamentals of a bio-psycho-spiritual social model that we have, that we are using together to figure out the fundamental basis of what actually lies underneath a human being's suffering and their wellness? So what happened to all that? Well, throw all that out the window. Instead, what we get now is give me strategies, give me skills. Can you give strategies? Can you give skills? Psychologists now, therapists now are swapping skills with each other. Like, hey, have you ever heard of this skill? No, I haven't heard of that skill. Give me some of that skill and I'll give you some of this skill. And then we have these massive pamphlets and books and workbooks that we can go and we can use these skills to, what are we even on about? What happened? What we've been doing for years and years has been chewed up into some business model version of, at least I gave you something. You come in, you pay money, and because I'm only sitting here for an hour, I haven't done anything, have I, as a therapist? I haven't actually listened to you, tried to figure out what's going on, tried to help you figure out what's actually going on within you as a human being. Well, that doesn't matter. Did I give you something as you left? Like, here, you know what? Here, have this as you go home today. Like, have something, because obviously it's all part of the capitalistic machinery and chewing things up and making it like, unless you give me something that I can hold in my hand, then I haven't actually gotten anything. Well, I tell you what, my patients, they get out of therapy with a lot. They come out with a lot, and I don't need to give them pieces of paper. I don't need to give them manuals that they go and they complete things into, and I don't need to do any of that stuff. And my patients still get a whole lot out of therapy. So what's happened then? Well, as I'm calming down a little bit, what's happened is, look, at some point, psychotherapy went from being about, rather than understanding, rather than helping a person genuinely understand what goes on within them, it became a business model. It became, how can we reduce symptoms as much as possible? Some people have called that the medical model. Meaning that, you go to your GP, you go to your doctor, they ask you questions, you say what's wrong, they prescribe you a medicine, you take that medicine, and you are now seemingly better. Now that works, possibly, I say possibly, for the medical model, because we also know that one of the biggest issues in the medical model is adherence, and it's about 50% of people adhere to their medication. Truth, I didn't say it, World Health Organization said it. That doesn't make it true necessarily, but anyway, that's what I read it. So what does that mean? It means, well, maybe rather than adhering to the medical model where, people come in, they break things and we fix it, and they break things and we fix it, and they break things and we fix it, maybe instead we as psychology should be differentiating ourselves a little bit, because we are different, because we're not medicals, because we don't operate that way. And if you ask any psychologist in the world, and actually I would think any medical doctor in the world, they'd rather be working towards prevention of problems as opposed to symptomatic control. So what I mean is, any psychologist in the world would rather work with you in a deep level to ensure that you actually thwart your depression in the future, as opposed to I don't know, wait till you get depressed again, boost you up again, wait till you get depressed again, boost you up again. It's like, what are we doing? Every single patient who comes to me says that my psychologist has told me that I need to exercise, that I need to eat well, that I need to sleep well, and I need to kind of, socialize. Look, yeah, those things are true about humanity. We need exercise, we need sleep, we need to we need to socialize, we need to go outdoors on the occasion. Is that what I am meant to do now as a psychologist? Sit there and no matter who comes in, what issues they come in with, I'm like, pretend like I'm not going to say this anyway, right? Have you ever thought about exercise? Have you ever thought about that? Oh, the deep insight that you have provided me, the notion that exercise might be good for me. How many years of studies have you done? Well, I've done now almost 20 years of psychology studies, and that's the conclusion that I came to. I think exercise would be good for you. Oh, thank you. Geez, golly, thank you, doc. They walk out, and then the next person comes in. You know what? Looking at you specifically, I'm thinking, you know what would be good for you? Some exercise. No, that's not what we are. We do so much more than that. We help people figure out the most intricate, complex labyrinth that is their mind, and we are trained to do that, and you should be trained to do that. And if you're not trained to do that as a therapist, then get more training to be able to feel like a patient can come to you and say, look, last night I had a dream that I slept with my mother while my father was watching, and then actually all of a sudden I was with you in the room, and there you were, and you were kind of not happy, and you were wagging your finger, and what does that mean? Such that you can help them figure out what that could possibly mean. I'm not talking about dream interpretation. I'm talking about being able to help your patient feel heard and understood when they've had an awkward dream, as opposed to panicking within yourself and going, oh, I don't know what they're on about. I should just change topic because I think that actually doesn't relate to what we're talking about. Look, let's talk about your depression. Let's not talk about your dream. I don't know. Like, we should be able to meet people where they're at, right? We should be able to talk to people about what they want to talk about. We should be able to help them around what they want to be helped about. And I'm so sick of us reducing ourselves, of the world reducing us to a simple advice giving machine of the 5 things you need to do to be healthy as a human being: exercise, sleep, socialize, eat well, sleep well, whatever. It's like, no, I'm not doing that. So I'm not. So if you come to me and you're like, what are the 5 things? I'll be going like, Google. You can go to Google. I am not Google. Don't come to me for Google. Go to Google for Google. I'm not Google. Google is Google. YouTube is YouTube. I'm not YouTube, even though I'm on YouTube. And if you like this rant, please please subscribe. Please let me know if you want to hear me rant about other things, or if you don't want to hear me rant about other things, just give me a like that I ranted about this thing. I'm not. Oh gosh. Anyway, thank you. Thank you, YouTube, for listening. I feel like this one was for me, not for you guys. Thank you for listening. I feel a lot better, actually. Thank you.